I had excessive bleeding, which caused me to become anemic, and because of that, I was exhausted all of the time. The lower back aches, frequent urination, and I even had cravings. I just felt absolutely miserable.
Who recommended a different OBG, and he wanted to give me a total hysterectomy, which he prescribed and told me I needed without even, prior to evaluating me, which was kind of a red flag.
Excessive bleeding. I didn't have any pain. It was just getting to be unmanageable.
Unmanageable bleeding. And that's when I started looking for solutions.
From about in a period of less than a year, they doubled in size. And so she, after she saw the results of the latest ultrasound, she recommended that I have a hysterectomy.
My husband and I were trying to have a baby, so we waited as long as we could, and the bleeding got so bad that I got to a point where I had to make a decision on if I wanted to have surgery or not. Anytime my period was going to start, I had to stay at home, or if I went to work, I literally didn't go anywhere, just to my office and to the restroom. If I was home, I didn't leave the house because the bleeding was so intense. The bleeding was it was horrible.
The women you just heard from were once just like you, suffering from fibroids. But today, they're living a fibroid-free life. If listening to these women's stories impacted you, then you owe it to yourself to register for our free online videos so that you can get full access to all of our patient stories. These women have shared their time and their stories to help change your life. There's no better way to learn about fibroids than to hear from women who have already gone through what you're going through today. Register now and let myself and my past patients put you on the road to a fibroid-free life.
One of the reasons why I agreed to do this video is to just help women make the most educated decision. And again, if the decision is that you have to have a hysterectomy, then at least you did it knowing all the other options that are available to you.
And I asked him if I was a candidate for embolization, and he told me no. But here I am. It turned out I was a great candidate.
And she's a really well-respected doctor in the community. She had had a hysterectomy herself. That was what they did back in the day. She's a little bit older. And so no, I had to find this was an option myself.
I would recommend UFE to anyone that's suffering from fibroids. It definitely made a believer out of me. I was really, really ingrained in hysterectomy, let's do this, let's get it over with, but the UFE decision was the best one that I've ever made.
Even after I asked if there were other options, she said no, and there's no after effects after having a hysterectomy. You shouldn't worry about side effects. There's none, and I knew that there were because I talked to people who had them, and I wanted to avoid that.
My other concern about having a whole hysterectomy was other women have told me that when you have a hysterectomy, it changes how sex feels, it changes how you orgasm. And I asked the other OBG if that was in case, if that was true, and he told me absolutely not. Which it kind of seemed like an integrity test to me, because if I have 5 women who've had hysterectomies who say, yeah, orgasms aren't as good afterward, and then I ask a male doctor and he says, no, your orgasms will be the same, I feel like the women know better. So I took their word for it, not his.
My OBGYN actually recommended UFE for me, but she also informed me of my other options such as myomectomy, laparoscopic surgery, hysterectomy, and birth control pills.
So the OBGs did not refer me. In fact, they told me that this kind of treatment would not work for me. It's not really doing the best thing for the patient, or letting the patient choose, or telling them what all of their options are.
You trust these doctors that they know what they're doing and that they give you all the options that are available. But again, after talking to my friends and relatives, I discovered that there's many options.
Even if your doctor has already told you what he or she thinks you need for your fibroids, you owe it to yourself to register for our online videos so that you can learn about all of your treatment options and choose the option that is right for you.
I think that it all comes down to education, really, from doctors. perhaps she's not aware that there's these alternatives to fibroid treatment. Although when you look at the internet, it's on Dr. Oz. It's kind of mainstream knowledge. I didn't know it, but you would expect that your gynecologist would.
I think I had it 7 months ago, and now I've lost 12 pounds. And I run 5 miles a day every day, and that was something I couldn't do before the procedure.
Yes, I highly recommend Dr. Harris and the Fibroid Treatment Center. And I definitely recommend UFE. UFE has made a significant improvement in my quality of life. And to anyone out there suffering from fibroids, I say, do your research. Know that you have choices, know what those choices are, and take the appropriate action for you.
My symptoms have improved tremendously. I can't even thank Dr. Harris enough. I have such a better quality of life.
100% recommend the surgery and 100% recommend Dr. Harris. I think he just did such a good job in making sure that we understood the procedure, everything went as planned. It was so much easier than I thought it was. And yeah, I would have done it a lot sooner if I had known that it was going to work that well. Relatively easy, yeah.
Now, I don't have to worry about that. I can plan vacations, I can go out, I can do things. I actually have a regular life now and just a better quality of life. I would recommend UFE to anybody.